Let's talk about antihypertensive medication, which is ACE inhibitor, angiotensin converting enzyme inhibitors. So, anti is against, and hypertension means high blood pressure. Antihypertensive medication is which medication helps to reduce the blood pressures. There is a few types of blood pressure medication. Today I am going to talk about ACE inhibitors. ACE, angiotensin converting enzymes. Angio means blood, tensins means vessels, inhibitors means stop or hold back. To remember, the suffix of this medication is fril. Genetic name captopril is capoten, and lisinopril is gestrel. Ramipril is Altace. Enalapril is Besotec, and Benazepril is Lotensin. This medication is used for hypertension, heart failure, heart attack, kidney disease, decreased progression of the neuropathy of diabetes, and migraine headaches. This medication reduces blood pressure only, not the heart rates. Okay to give even if the heart rate is low. One of the NCLEX question is, should you hold if the heart rate is low? The answer is no. If heart rate is low, you still give these medications. Mechanism of action of ACE inhibitors. Before we discuss about the mechanism of action of ACE inhibitor, we need to know the RAAS system is renin angiotensin aldosterone system, which is angiotensin 1 converting to the angiotensin 2 in the lungs, and then converting to the angiotensin 2 causes the vasoconstriction, potassium loss, and sodium and water reabsorption. So ACE inhibitor usually helps to relax the vein and arteries and then lower the blood pressure. So stop conversion of the angiotensin 1 to the angiotensin 2. So angiotensin 2 constrict the blood vessel. We don't want to constrict the blood vessels because ACE inhibitor stop the angiotensin 2. So since ACE inhibitor stops angiotensin 2, which vessels is not constricted anymore, so as a result it dilates the vessels and keep blood pressure down. So it is also risk for the potassium retention and preventing the vasoconstriction. So just think about the water hose on your house. How if you constrict your water hose, it takes longer to fill the buckets. So next is ACE inhibitors prevent the secretion of the hormone called aldosterone. This hormone is responsible for the retaining sodium and water, which increases blood pressure. Since ACE inhibitor stop secretion of aldosterone, so body does not hold sodium and water, so as a result lower the blood pressure. This is the ACE inhibitors mechanism of actions. Side effect or precautions of ACE inhibitors. A is ACE. A is for stand for angioedema and avoid for pregnant women. Angioedema is the swelling of your face and then throat. It can cause the breathing difficulties, and avoiding for the pregnant woman. This medication is teratogenic. This is harmful for the fetus. And C is cough, dry cough. It is normal for the patient who is taking ACE inhibitors. And E is elevated potassium electrolyte imbalance. This is very dangerous because it can cause the cardiac arrhythmias. When patient taking ACE inhibitor, they need to monitor regular blood pressure checks, especially before taking the medication. May cause dizziness, especially first dose. Always patient need to get up slowly and monitor for the hypotension. It can cause rhabdomyolysis, and also monitor for the hyperkalemia, and careful when use potassium supplement or potassium sparing diuretics. Also rarely worsening kidney function, but still need to monitor for the kidney functions. And then some special notes I want to say, pregnant women increase the risk of the birth defect. When they take ACE inhibitors, they need to be careful. They need to talk to the provider before take the ACE inhibitors. And then blood to blood interaction is NSAIDs can decrease ACE inhibitors effectivity. So when you take the NSAIDs and ACE inhibitors, just be careful. Let's practice few practice questions. Question number 1 is angiotensin converting enzyme inhibitors can be prescribed in which condition? This is from the indication we know that congestive heart failure. So bilateral renal artery stenosis, pregnancy, renal impairment is not the correct answer. From the indication we know that congestive heart failure, heart attack, and the neuropathic kidney disease or diabetes neuropathy disease, and then migraine headache, those kind of disease can be treated with ACE inhibitors. Next one is the action of angiotensin converting enzyme inhibitors ACE. Angiotensin 2 receptors blocker ARBS and direct renin inhibitors on the renin angiotensin aldosterone RNAA system lower blood pressure and reduce the adverse effect on which of the kidney. This is the answer is diabetes. Number 2, the action of the ACE, ARBs, and direct renin inhibitors RNAA system lower blood pressure and reduces the adverse effect of diabetes and kidney. Next one is the patient called the office the morning after he started angiotensin converting enzyme inhibitors and complains that hoarseness and swallowing lips, which in instruction from the APN is most appropriate. This is definitely stop drug immediately, because this is the reaction from this medication. So it's called angioedema, hoarseness, and then swallowing lips. This can be life threatening, so we need to stop immediately and contact the provider for the epinephrine or some kind of allergic medication. So next one is Ray has been diagnosed with hypertension, and angiotensin converting enzyme inhibitor is determined to be needed. Prior to prescribing this drug, NP should assess for answer is the decreased renal function, hypokalemia, impotence, and inability to concentration is not the correct answer. The correct answer is decrease for the renal function. Next one is angiotensin converting enzyme inhibitors are the drug choice treating hypertension diabetic patient because they are improve insulin sensitivity, improve the renal hemodynamics, reduce the production of angiotensin 2. So answer is all of them above. All of them above is the answer. Next question is the angiotensin converting enzyme inhibitors are useful in a variety of disorders. Which of the following statements are true about the both of the usefulness in the disorder and the reason for it? Number 1 and number 2. So answer is both number 1 and number 2 is the reason. So stable angina because it decreases the thickening of the vascular walls due to the decrease of modified release. And then number 2 is heart failure because it reduces remodeling of injuries myocardial tissue. So both number 1 and number 2 answer is the next question is a potentially life-threatening adverse response to the angioedema. Right answer is the swelling of the tongue and hoarseness. So these questions I already talked about it. This is the life-threatening event. You need an immediate evaluation.